Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans. Welcome back, Chicago, to another episode of Healthy Chicago podcast. I'm your host, Dr. Borah, and I know we've had, three amazing guests so far, but I think today is really going to be something special. We have, one of the most inspiring people I've ever met. I am so thrilled, so excited to introduce Dr. Ige, the newest commissioner of public health here in Chicago. Welcome to the show, Dr. Ige.
Thank you, Dr. Borah. It's a pleasure to be here, joining this amazing space and showing a little bit of myself to the city of Chicago.
It's been so fun having you aboard. You've only been here, I think, just around 2 months, right?
That's right.
Which seems like a short time, but I think at the same the other end of the coin is that you have already jumped into the Department of Health, and I think really put your mark on so many different projects and goals and talking points, and I hope we're going to get into some of that today. I wanted to start though and give you a chance. I know you've had 2 months to introduce yourself to Chicago and to be introduced to Chicago. But if there's anything else you want to say about who you are and how you arrived here at the Healthy Chicago microphone, now's your chance.
Well, thank you, Dr. Borah. When I get asked that question, tell me about yourself, I always wonder where to start. There's a little part of me that loves stories, so I'm going to tell you a story. When I was about 10 or 11, I was in an elementary school that was a very diverse elementary school when you talk about class. And I used to go to school with a packed lunch, and some other kids didn't have a packed lunch. So it was always embarrassing for me to bring out my lunch and then look around and some of my friends didn't have lunch. So I will share my lunch with my friends. And there was this event where, you have birthday parties and kids celebrate and you get favors and all of that. And it didn't go around. And I also offered to give my favor to another child. And when I was 10, my teacher said something to me and she said, you have a gift for humanity. And I wrote it down. I didn't know what that meant. Mm-hmm. It's like, what is humanity to a 10-year-old? So that's just a story to say that I have always known what I wanted to do. I have always known that I wanted to share. Mm-hmm. I have always known that I wanted to live in a world that is equitable, where people can enjoy the same things that I'm enjoying. Mm-hmm. And I've always known that I had some privileges that others didn't have, and I felt a sense of responsibility to do something to make the world a better place. So that has been my story. Mm-hmm. I chose medicine for that reason, so that I could give back, because I was surrounded. I grew up in West Africa, in Nigeria, and I was surrounded by a lot of preventable diseases, and I felt like I could do something about it. Mm-hmm. And it has now been almost 20 years in public health, doing the things that I love, which is contributing in a meaningful way to make the world a better place. And whether that is in seeing patients and writing prescriptions for them, or just spending some time to talk with, a senior who just wants to talk about feeling lonely, or that is, or brainstorming with colleagues like you and trying to figure out how we can make Chicago better. These are all the things that I enjoy doing. So that's who I am. And I hope that in the 2 months that I've been here, people have seen that to be consistent with just wanting to make things better. Mm-hmm. And wanting things to be equitable and people to enjoy a good, healthy life.
Thank you so much for that. And I'm curious too. You said you were called into medicine. Was public health? Did you have to pivot at any point into public health, or did you know sort of medicine and public health together would be where you would end up?
Yes, I started my journey in medicine. For people who say, what's the difference?
Yeah.
Medicine is about treating people when they're sick. So it's something has already gone wrong, and then you're trying to fix it. Public health is not letting that thing go wrong at all. And so I started my career as a pediatrician, working with children, and trying desperately to make the children better when they're sick. And I saw that a lot of the cases that were coming to me could have been prevented. If only the children had the right vaccinations, or they had the right food, or the parents knew how to identify some of these issues and brought the children earlier. So I worked a lot in rural context in the global setting. And so there was a desire in me, again, this desire to make things better. And I thought maybe going upstream will be the way to do that. So I went, that was a moment when I pivoted and I said, I would like to move into the prevention space. So these days I introduce myself as a preventionist and say that 70% of the things that bring us to the hospitals could have been prevented at home. And so that is now the area where I operate within the prevention space. That's the public health piece. But about 7 or 8 years ago, I also started to realize that your health as an individual is so closely connected to the health of a community. Where you live, the food that you have, the opportunities available to you, these things have a greater impact on your health than just knowing what to do even, or just your behaviors.
Totally.
So I became, again, at that point, drawn into, is there another way? Is there a better way of supporting the health of people? And wanted to move up into the policy space. So now they call that primordial prevention and say, let's put in policies so that before things go wrong, we have already fixed it by putting in policies in place to make things better. So now I'm in the policy space, prevention space, as a public health strategist and leader, and I'm loving it.
That's awesome. And I think that resonates a lot with me, because what I love about public health is how broad and multidimensional it can be. It's not only, of course, there's a portion of it that aligns very closely with clinical medicine. Yes. We deal a lot with infectious diseases, for instance. But you mentioned things like food and community and opportunities and policy. And those things, I think a lot of people don't immediately think as related to a career in medicine. And even, maybe, folks may not know that all of those things are involved in a public health career too.
Yes.
So with all of those things in mind, both infectious diseases, medical conditions, but beyond that, what have you what have you hit the ground doing here in Chicago? As far as any of these realms of public health.
Right. Well, thank you, Dr. Borah. I think that anytime you arrive in a new place that you want to call home, it is always important to start with knowing the people. So one of the first things I wanted to do is get to know my people, get to know the communities, get to know the older people, get to know the staff, the folks who have been working hard to make Chicago better. So one of the things that I did was, spend some time with our staff, spend some time in the community, spend some time with the elders, getting to know what is it that works. That's helping you stay healthy. And what is it that is not working, that is a threat to the health of Chicagoans? So that's one of the first things that I did. And then getting to understand what resources or opportunities do Chicagoans have to stay healthy.
Right.
And there are many different pieces of that I've understood. One, there are 16,000 licensed food establishments in Chicago. So when you sit down at your favorite restaurant or you go out for a bite, we want to be sure that you're going home with a smile and feeling satiated. And nothing else. With no virus, no stomach bug.
Right.
And so it is part of our work to make sure that you can have healthy food. And we're doing a pretty good job of that.
Mm-hmm.
We also know that when you live in communities, there are things in the air, there's things in the water that may impact your health that you may not even know about. So ensuring that our environment is healthy and safe is also another area of work that I explored and learned about. So right now we just concluded a cumulative impact assessment. And that's to understand what if I'm exposed to environmental pollutants, but also exposed to air pollutant, but also exposed to water. If I add all those things together, does it take a disproportionate impact on my health? And the answer is yes.
Mm-hmm.
So that's understanding the threats to health. So that's another area that I have discovered. We also have all kinds of infectious diseases.
Mm-hmm.
It may be exciting for people to know, or maybe terrifying for people to know, that there are over 70 different infectious diseases that we track at the Chicago Department of Health.
Yep.
And part of my work, again, is to find out, are we doing it well? Do we have any challenges? Are there
Right.
things that are threats to Chicagoans? And so these are some of the initial assessment. And then based on all of these different ways and opportunities and resources necessary to keep Chicagoans healthy, we have started to map out where we can do better. Understanding people and places is another area of my passion. Who is most impacted? What places are most impacted?
Mm-hmm.
That's my passion for equity, making sure that we are supporting people based on their needs. And that starts with asking who is most impacted, which places are most impacted, and then that guides our activities and plans. So those are some of the things that I have been doing.
And I'm sure, you've understood and know that Chicago is not a monolith, right?
That's
I mean, we're a city of neighborhoods,
Right.
and there's so much diversity in culture, but also in need across the whole city.
Right.
So I guess how does the health department strategize to create plans specific, to one part of the city that needs something, but maybe another part of the city doesn't need that, or does the health department do things like that?
Right. Yes. So CDPH, one of my attractions to Chicago and the Chicago Department of Public Health, is our approach of using life expectancy as our North Star. Life expectancy is exciting to me because in many areas of medicine or public health, we focus on one disease at a time.
Mm-hmm.
It's either the opioid crisis or maternal mortality or COVID. Now, all of these are threats in themselves, but a human being is a whole person. So life expectancy is a snapshot of the entire experiences of the individual. So focusing on that gives us an opportunity to treat people as complete people, looking at all of the different threats simultaneously. So one of the things that we have been working towards is how can we close the gaps in life expectancy among populations in Chicago. And to do that, we ask ourselves, why are there gaps? Why is it that some folks get to live to 80 and some folks only live up to 75?
Right.
And based on the responses to that, we saw that there are some diseases that disproportionately impact some communities. And then you start asking why.
Mm-hmm.
Then you realize that some communities don't have opportunities. They don't have fresh food. They don't have doctors. They don't have access to vaccinations. And based off of that, we are now planning how we can better support those communities. So opioid crisis, for instance, disproportionately impacts the Black community.
Mm-hmm.
So we are now at the table brainstorming with communities what we can do different to ensure that that need is addressed so that the quality of life and the life expectancy can improve. So those are some of the ways we're approaching our work. I
hear in everything that you're saying, putting equity front and focus into everything that we do. If I assume that's an assumption, but I think it's true, and I'm wondering if you can expand upon that and just remind people like why this is such a core part of what we do in public health, why it's so important, and in addition, if there are any other grand, goals, visions that you have for the health department, or really like underlying frameworks that you've taken from your past experiences that you're hoping to apply here. If you could speak to any of that.
Right. We desire a world where everyone can achieve their full potential.
Mm-hmm.
And health is something that I believe is a human right. Everyone should have access to the resources and opportunities they need to stay healthy. But the reality is, in our world, it's not always so. Health is not just the absence of sickness and disease. So I'm able to go to work today. That means I'm healthy. No. Health is physical, mental, spiritual, emotional well-being.
Mm-hmm.
And we find out that because of the living situations, because of discriminatory policies and practices, that we have set up a healthcare system or public health system that have favored a majority group.
Mm-hmm.
To the detriment of other groups.
Mm-hmm.
So there is a need for us to always assess for the impact, not just the intention. Many of these policies were designed, without malevolence, but they have impacted communities disproportionately. For instance, if I am a business person and I want to set up a grocery store, I want to go to the communities that have the most money because my primary motivation is money.
Mm-hmm.
What then happens is that certain communities that are more affluent have all the benefit of the wide range of resources, and communities that are not affluent do not have those benefits. And so if I have to eat 5 fruits and vegetables, the 5 servings of fruits and vegetables a day, then I either have to get on a bus or a train to go look for these things.
Mm-hmm.
Again, I am low income right now, so I have to work harder to stay healthy.
Right.
Now, these are factors beyond the individual to control. This is where government comes in to say, how can we right-size some of these things? Now, if I stay in the space of just educating this individual and say, you have to eat 5 servings of fruit without understanding that broader context, then the burden keeps piling on this individual, and we blame this individual for not doing the right things to stay healthy. But their conditions and the environment and the opportunities to stay healthy is not there. So they have to work harder to get there.
Right.
And this is why we infuse health equity, and that lends into everything we do. If we want to cite a clinic, if we want to do a program, we want to consider, will this program be accessible to everyone? If they don't speak English, if they live in a difficult, farther area of town, if they're older, if they have a disability.
Mm-hmm.
So these considerations must be included in all of our planning
Mm-hmm.
and execution. If we're not intentional about this, we then forget it, and then we have the negative impact. Not because it was designed to do so. In some instances, it is designed to do so. But even when it is not intended to do so, if we are not deliberate in looking for the health equity impact, we will have an inequitable outcome.
Yeah.
And so that's why it's front and center and priority for everything we do.
Yeah. So it's not just, getting a person the right sort of foods or responding to a single outbreak. It's really intervening upon the systems in place,
Right.
changing incentives and so forth so that those inequities don't exist in the first place.
Right.
And you mentioned a lot of things, food, housing, jobs. I mean, these things must require partnership beyond the Department of Health too. So how does your role facilitate those partnerships?
I like to say public health is about the public. And people also like to say nothing about us without us. Public health requires an all-of-community approach.
Mm-hmm. Mm-hmm.
There are folks who know the communities better than we do. There are folks who have lived the experience, who can say, this is the best way to do it. The way we do public health in the 21st century in 2024 must recognize that expertise is more than medical expertise. And so bringing experts to the table who can inform strategy and implementation and community engagement. So our work is done in partnership. The mayor, Mayor Brandon Johnson, likes to say the 3 C's of his administration: competence, compassion, and collaboration. Our work at CDPH is always done in collaboration, not just asking for input, but also collaborating in implementation of the program. So we do work through delegate agencies who know the communities, and who are able to design programs that is best suited for their communities. So we work with community-based organization in our mental health work, in our vaccination work, in our food protection work, in our environmental work, across all of our different initiatives. We collaborate with those who are on the ground, community representatives, the ward offices, etc., to be sure that what we are designing is appropriate for the communities that we are trying to reach.
Well, Dr. Ige, this has been so great. I want to make sure that before we close, I get a little bit about your first impressions about Chicago, too. How has it been? Who have you met? What foods have you eaten? What do you think?
I love it. I am telling you, I came from New York. New York is a big city. This is a big city with a home vibe. People are warm. People are helpful. I said, I'm always lost, and there's always someone asking, how can I help you? And that's just refreshing. And then food, oh my word. I have been doing a food tour, hitting all the spots across the city. I have to, maybe some of these are not very healthy things for me to be eating, but I am a foodie, and I've been trying. I get recommendations from people all the time, so.
Any places that you've tried that you want to?
You wanted me to make commercials on
well,
places.
Yeah, I guess that's true. Yeah, maybe we shouldn't do that.
Right, but there are a few good fried chicken places and burger places and Italian food and.
Oh, I'm glad to hear that you've been taking advantage.
Even Polish food I've tried, and there African food and Mexican food. And,
so I'm not Polish by birth, but I married into a very Polish family.
Oh.
And do you know about the holiday coming up next week?
Oh no.
Punchki Day.
Oh really?
So this is the Polish version of Mardi Gras. So next Tuesday,
yes,
be sure to get a punchki or a that's the plural form, and I'm not sure what the singular version is.
Right.
But it's essentially a donut, or it's a donut-like treat that you as a Chicagoan should be eating next Tuesday to celebrate Punchki Day and to celebrate Chicago.
I will try it.
Good.
I will try it.
All right. Well, Dr. Ige, thank you so much. This has been such a pleasure.
Thank you.
I hope it's not the last time. I hope you join us again.
I will.
Right.
Call on me anytime. It's always great hanging out with you, Brian. It's a pleasure to, again, like I said, share a little of myself with the audience.
Well, thank you so much. And, I unfortunately think that's all the time we have today. Thanks, everyone, for tuning in. We will see you soon. And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Borah, and we'll see you next time.